Question number 1. A patient is diagnosed with first degree heart block. As a part of the investigation, EKG is taken. What is the hallmark finding of first degree heart block? Options. Option A gradually lengthening PR interval with a random dropped QRS complex. B. A PR interval greater than 0.20 seconds. C. Independent P waves and QRS complexes. And D. A constant PR interval with random dropped QRS complexes. So here the right answer is option B. A PR interval greater than 0.20 seconds. This rhythm looks a lot like normal sinus rhythm, but it has a subtle secret. The PR intervals will be prolonged, that is greater than 0.20 seconds, regularly throughout the rhythm. It can be normal for some patients. However, it can be present with a myocardial infarction or due to medications like calcium channel blockers, digoxin or beta blockers, which slow down the AV node conduction. Question number 2. A child is treated for bacterial meningitis with an intravenous antimicrobial agent. Which of the following best indicates effectiveness of the treatment? Options. Option A. Increase appetite. B. Decrease the body temperature. C. Improve respiratory effort. And D. Disappear of subcutaneous nodules. So here the right answer is option B. Decrease the body temperature. Decreased body temperature, that is a better indicator of the effectiveness of treatment for bacterial meningitis. A reduction in body temperature suggests that the infection is being controlled and the body is returning to a normal state. Question number 3. Which of the following is not a risk factor for ectopic pregnancy? Options. Option A. Prior history of pelvic inflammatory disease. B. Prior history of infertility. C. Prior history of uterine fibroids. And D. Prior history of ectopic pregnancy. So here the right answer is option C. Prior history of uterine fibroids. So although a history of infertility, prior ectopic pregnancy and previous tubal surgery are all risk factors, a past history of pelvic inflammatory disease, especially that is caused by chlamydia trachomatis, that is most important. Question number 4. A client with cirrhosis presents with ascites and hysteresis. The nurse notes that the client's ammonia level is elevated. Which medication should the nurse anticipate administering? Options. Option A. Spironolactone. B. Lactulose. C. Rifaximin. D. Furosemide. So here the right answer is option B. Lactulose. So lactulose is used to reduce elevated ammonia levels in clients with hepatic encephalopathy. It works by converting ammonia into ammonium, which can be excreted in the stool, thus reducing the ammonia levels in the blood. Spironolactone and furosemide are used to manage ascites, and rifaximin is an antibiotic that can also reduce ammonia, but lactulose is the first line treatment for high ammonia levels. Question number 5. A parents of 9-month-old express concern that the baby is developing slowly. The nurse concerned about a developmental delay when finding the baby is unable to accomplish which skill? Options. Option A. Vocalizing single syllables. B. Building a tower of 2 cubes. C. Drinking from a cup with little spilling. And D. Standing alone. So here the right answer is option A. Vocalizing single syllables. So typically a 9-month-old infant should have been voicing single syllables since 6 months of age. Absence of this finding would be a cause for concern. So an infant usually able to stand alone at about 10 months of age, and at 15 months of age the infant is able to build a tower of 2 cubes and drink from a cup with little spilling. Question number 6. A 52-year-old woman presents for her annual examination and gives a history that she has not had a menstrual period in 2 years. Which of the following is least likely to be associated with the menopause? Options. Option A. Osteoporosis. B. Weight loss. C. Genital atrophy. And D. Mood disturbance. So here the right answer is option B, weight loss. So estrogen deficiency causes most of the signs and symptoms and sequelae of menopause, including bone loss, hot flushes and genital atrophy. Weight gain is common especially in the lower abdomen, buttocks and thighs. A bodily adaptation in humans over the time to both retain what little estrogen is left in the body longer and to protect the long bones with padding as estrogen level is decreased. Question number 7. A client with chronic kidney disease is prescribed a phosphate binder. Which dietary instruction should the nurse provide? Options. Option A, increase consumption of dairy products. B, limit intake of high phosphorus foods. C, increase intake of citrus fruits. And D, avoid food high in potassium. So here the right answer is option B, limit intake of high phosphorus foods. So phosphate binders are prescribed to reduce the serum phosphate levels in clients with chronic kidney disease. Instructing a client to limit intake of high phosphorus foods, it helps to prevent hyperphosphatemia and its complications. Question number 8. A 2-year-old child is brought to the emergency department with barking cough, inspiratory stridor and mild retractions. The mother reports that the child has cold-like symptoms for 2 days before the cough began. What is the most likely diagnosis? Options. Option A, asthma. B, bronchitis. C, croup. And D, epiglottitis. So here the correct answer is option C, croup. So croup is characterized by a barking cough, inspiratory stridor and retractions. So it typically follows a viral upper respiratory infection. Asthma, bronchitis and epiglottitis have different signs and symptoms. Question number 9. Which of the following symptoms is not commonly associated with menopause? Options. Option A, hot flushes. B, vaginal dryness. C, weight loss. And D, sleep disturbances. So here the right answer is option C, weight loss. So common symptoms of menopause include hot flushes, vaginal dryness and sleep disturbances due to the decline in estrogen levels. Weight gain, not loss, is more typically associated with menopause. Question number 10. Which issue would a hospital unit's quality improvement committee most likely address? Options. Option A nurse who made 3 medications errors in the past quarter. B, increase in catheter associated infections. C, staff perception of hospital laboratory personnel incivility. And D, a 10% decrease in client satisfaction in the registration process. So here the right answer is option B, increase in catheter associated infections. So a quality improvement committee primarily focuses on system-wise issues that affect patient outcomes. So an increase in catheter associated urinary tract infections is a systemic problem that can be addressed through process improvement, education and protocol changes. So the another options are more focused on individual cases or specific departments rather than a broader systemic issue. Question number 11. A nurse is caring for a client with suspected meningitis. Which action should the nurse take first? Options. Option A, initiate isolation precautions. B, prepare the client for a lumbar puncture. C, administer prescribed antibiotics. And D, obtain blood culture. So here the right answer is option A, initiate isolation precautions. So meningitis can be highly contagious, especially bacterial meningitis. Inhibiting isolation precautions first help to prevent the spread of infection to other clients and healthcare workers before diagnosis or diagnostic procedures or treatments are started.